in listen-only mode.
Good morning. Hello, everybody. Thank you for attending today's webcast, Data Mining Health Information. Before we get started, I invite you to submit questions in the dialog box, question box, or the chat box, and we'll take a few of those at the end of the presentation. Also, we'll send everyone a copy of the presentation slides following the webcast. Our presenter today is Chris Peters, founder of GPS Consultants. As a certified fraud examiner with an MBA, Chris has a unique mix of technical expertise and business savvy to help his clients resolve issues, reduce costs, and standardize processes. He takes a holistic approach to helping his clients identify and eliminate inefficiencies, fraud, and waste. Before founding his own consulting practice, Chris was a CFO for one of the largest home remodeling companies in the country, where he improved the company's operations and helped them expand into new markets. Chris is an expert idea user and proficient at developing and using idea scripts. Today, he will share some of the data mining techniques he's used to dig deep into health information at the transaction level. Chris, thank you for joining us today, and we'll turn it over to you.
Okay, great. I appreciate the introduction. Good morning, everyone. Really, before we get into my presentation, I wanted to kind of give you a high level of the purpose of my presentation. And the purpose or goal of my presentation is to show you guys a glimpse of the possibilities of how idea with the proper application and techniques can help set your health organization apart from your peers in the areas of compliance monitoring, financial performance monitoring through key performance indicators and benchmarking, and also business intelligence and data mining proficiency with an ability to detect unwanted discrepancies such as errors, fraud, waste, and abuse. So before we get into this, I always like to take a step back and say, okay, why data mine health information? I think we all can agree that, that there's plenty of reasons to do that, but the key reason, in my opinion, is the fact that the answers are in the data. And when I say answers, you know, the various things I'm looking for are things like revenue leakage, like improper payments or payment abnormalities, or anomalies, errors, fraud, waste, abuse, you know, all of these different things. But not to mention other things such as patterns and trends of suspicious behavior or deviations from business rules, all those types of things. So those are the answers I'm referring to. But you know, why use data mining opposed to maybe some other technique? And to me, the key reason is because you're able to mine an entire population of data using, you know, certain techniques that you can't apply if you're dealing with unstructured data, such as, you know, maybe support documents, maybe a chart, patient chart in this example. But you know, real quick, you know, I'm not going to read from these slides, but I did want to point out this last bullet point down here, where you can also use a data mining tool to not only compare across systems, but also to convert data and transfer information between these disparate systems, which is very important. So today's agenda, I'm going to cover some industry standard analytics. I'm sure most of these won't be new to you. Some of them may be. Then I'm going to get into some effective areas to data mine. And then lastly, I'll get into an example framework for developing analytics specific to your health organization. Okay, this is the little continuum here of the process of managed care contracting. I did not create this. Whoever did is pretty sharp. I like what they got here, and I don't know who did, because I got the image off of the internet, and did not get the source months ago, but I still wanted to show this to you because I thought it was very good. So unfortunately, I can't give the proper person credit for that, but I can tell you it wasn't me. But real quick, this kind of lays out the different processes. So, you know, scheduling. So what are the key things to check for when you're doing scheduling? Making sure that the patient, or verifying the patient's insurance eligibility. So you see eligibility verification under that. During the registration process, you know, verifying benefits coverage, etc. So I thought this was a good little way for us to kind of get a high level of what the processes are. That kind of, you know, instills what could go wrong as well. So RCM, revenue cycle management. So these are some revenue cycle management key performance indicators and benchmarks I have here. Most are going to probably be very familiar. Some may not be. I'm not going to sit here and read these off. I'm going to kind of just pick one and go through an example. But before I did that, I did want to say that you can benchmark with these. They have the HFMA. I'm kind of biased toward HFMA. I'm a member of them of theirs. So, being able to use this benchmarking application called MapApp, I thought was neat. I wanted to point that out to y'all. But there's plenty of other benchmarking tools out there. RMA has some tools. There's several others. But real quick, I just wanted to show you this so that you can go pull it up. The HFMA, their little map app. This is the web page for that. Get back over here. But the key thing I really wanted to show, instead of getting back into the slides, I'm going to show you, how we can actually use some of those things and not just know the analytic. So, for example, I don't want to just know, what my days in accounts receivable are. I want to be able to break that down and know exactly what the components are that make up that analytic, and also be able to data mine and drill down into, okay, what could be causing that analytic to not be as good as it could be. So I'm going to go into IDEA. And what I've got here, this is just some sample data I created. And this is some sample health information system data. So you can see we've got accounts and some fake patient names and case numbers, etc. So this would be all the information that we are inputting into our health information system as we're processing patient claims, etc. Okay, so one of those key analytics was looking at aging, right? So we've got some different dates here. We've got a date of service. We also have, some other dates here. We've got a charge entry date. We also have a transaction date, or this is when, the actual the insurance company or provider or payer paid us. So what we want to do is look at some of these dates and figure out, okay, are we doing good or are we not? So so the first thing I'm going to do here is take an age. So I'm just going to double click within here, and what that enables me to do is append a new field or add another field that I can perform a calculation on the data within here. And what I'm going to name this is data service to charge. So I want to know the number of days between my data service and when the actual charge was submitted. And you can save functions, etc., and I'll show you how to do that as well. So what I want to do is just use, over here, we've got date and time fields. They have an age function, and it tells you exactly how to do it over here. But if I just click this age function, it tells me to put the later date first. So what I would expect the later date to be would be the charge date, charge entry date. And then the more recent date would be the charge entry date. You put that first, and the later date you put second, which would be data service. And I'm just validating. So if I had that backwards, this would be a negative number right here. So I know I got it right. But another key age I want to know about is going to be from when that charge was entered to when the payment was received. It's also going to be a numeric field. I'm going to take the age of, let's see, charge entry date and it's called transaction date. Okay, actually got that backwards. I knew I did there. Let's see. Okay, evaluate that. I can see it's working properly. Okay, so now what I'm going to do is just click OK, and it's going to append those two fields. And it's going to append them all the way over here on the right. So you can see from data service to the charge date, it looks like 4 days, 3 days, and we can do some higher level analytics on that in just a second here. But then you can see the charge to payment date here. Obviously a little longer time frame here as far as number of days. So now that I have that on this entire data set or population, I want to go ahead and see, okay, well, what at a high level, what is this grade comprised of, or what are some different ways I can look at it? I can tell you for this first one, from data service to the charge date, that's kind of a internal processing type time. So I want to see that by the different people processing it, so the biller ID in this particular case. So what I would do here, I'm just going to create a pivot table. And what I'm going to do is I'm going to take this biller ID field that was in that raw data. I'm going to drop it over here. You can see that we have just 4 billers in this sample data set. And then what I'm going to do is I'm going to go find those 2 new aging fields that I just calculated. So I'm going to find this. Actually, let's see, right. 1 second. Here we go, data service to charge. Sorry about that. Okay, so you can see now it's kind of set to sum. That doesn't really tell us anything. I would rather know the average. So now I can see the average days to process by each particular biller. But another key thing I'd want to know is the maximum. Okay, so you can see here for biller 1001, I'm going to open this up so you can see it. The average number of days for this particular biller is 3. The maximum was 5. And you can see when we get down here to 103, it looks like 103 is causing some issues, right? Looks like their average is 6 days, which is twice as much as 101's. And you can also see that it took them 22 days on some of these just to get the bill out, which is obviously a anomaly compared to everyone else. But what's really neat about this is, so I can drill into 103's data that makes up this analytic right here, and I can see all of the transactions that made that up. I'm going to make this a little bigger so y'all can see it. So I can see all the different things that make that analytic up. And I can come over here and figure out, okay, which transactions were my biggest problem just by doing a quick sort. So I can see, real quick, there's that maximum 22 there, and I can just go through and see, and I could actually save this and do additional analysis on it, such as, is it a certain procedure that he or she is having problems processing? So now I have all of 103's data there, and I can perform additional analytics using pivot tables, etc. So that's one example of really being able to not only know what your score is or what your grade is, such as what that analytic is at a high level when we look at it maybe without the biller in there. Hold on, let me get that out. Okay, so when I'm just looking at the average, a lot of times our systems or reports, they give us this high-level analytic, but knowing it's 4, I wouldn't know that I had all of the problems that I could still fix and maybe get it down to 3. Because if I put that biller ID over in here, you can see that there are some that are pulling that average down, and in particular this particular biller. So go back to the data here. So what I want to do now is do another pivot table just to kind of look and see how we're doing on this other one, which is the when we actually submit the charge to when we receive payment back from the payer. And I'm going to use a pivot table again here to demonstrate this. Just give it a quick name, payer. So what I'll do here is I'm going to take the carrier information. You can see in this sample data set all I had was Blue Cross and Cigna. And what I want to do here is take the charge to payment date. And again, it defaults to sum, so all I'm doing is right-clicking here, and I'm changing that to average. So I can see the average days by payer. And what may also be a good thing to know would be the paid amount sum by payer. So you can see real quick here. Blue Cross, they make up 2.2 million of the payments in this particular population of data. Their average is 19 days. Cigna, on the other hand, is 36 days, significantly longer, and they don't make up as big of a population of money, though. Okay. So I also want to show you real quick the max as well. That's a good thing to know. So let's see. If I take this and drop that charge amount in there again, and I just come in instead of, charge to payment date. Rather than having the sum here, what I would rather have is the maximum. So you can see the longest was 195 days for a Blue Cross, 104 days for a Cigna. You could go in and look and see, okay, what was the reason for this 195 day claim? Why did it take so long to pay, for example? And I'm going to show you real quick how you can get to that. So this 195 day one, you can see it's got a bunch of stuff going on with it here, and you can see what the procedure code, etc., was, and figure out what went wrong. And you'll see a second ago when I sorted this, you see how we have this anomaly here as well. This is a potential error, fraud, waste, abuse as well, right? And we go and look and see why and what happened, and you'll see that looks like everything was going on in 2010, but when you look at the transaction date, someone accidentally keyed the 0 before the 1 and ended up with 2001 instead of 2010 on these two. So as a result of doing these types of procedures, you're going to find the errors as well. So those are my examples there. Okay. But there's all kind of others here, like I mentioned. But for the sake of time, we're going to have to continue to move on, press forward. But some other things that are good, revenue cycle drivers to monitor and benchmark. We kind of just did the payer mix on that particular population and looked to see, what some of the other analytics for those payers were when we looked at the maximum number of days and the average number of days that it took them to pay us. But some other good things to look at are your payer mix, and obviously all of these things are going to have impact on our revenue dollars and everything else. So these are big factors of the revenue cycle to also keep in mind, and an idea can help answer these questions for you and enable you to drill into them much deeper, like I just showed you a moment ago. Okay, so now I'm going to get into some effective areas to data mine, and these are really addressing the industry pains, in my opinion. Several of these we just went through RCM and a bunch of analytics there, but some of the other ones like the payment review contractors. This is obviously a very hot topic these days because these hired guns are recouping a bunch of money, and they're looking hard because they're paid by what they find. So some other things here: internal controls and fraud prevention. We're not going to really touch on that too much today, but we'll touch on it a little. But ensuring proper reimbursement. So doing this payer contract modeling, this is going to be something we're going to spend a good bit of time on today. But there's all kind of other areas too. Obviously, plenty of things to look at with the charge master, timely filing, eligibility, denials management, compliance, and as you know, the list goes on. Okay, so payment review contractors. There's a bunch of them out there. Here's some examples. We're going to cover RACs today in the physician or physician practice arena. It's more of Z-Picks and mix from what I've seen, but hospitals, all of them. But RACs is the one we're going to cover just because they're good examples, and they're very transparent with their program, so I'll be able to show you some stuff there. Okay, so improper payment examples that RACs are looking for, recovery audit contractors are looking for. So obviously medically unnecessary type procedures. So key one I have here in red is surgical procedures in the wrong setting. I'm going to show you a couple examples of that. So, I'm going to show you examples of these top three here. gender anomalies, age anomalies, and once-in-a-lifetime procedure anomalies. There's several others, but again, we've got to pick a few to go with. So I'll take you to Connolly's Consulting's website real quick. Okay, so the recovery audit contractors have to put out the CMS approved audit issues. So what they do on the website, Connolly is for Region C. I'm in Louisiana and they cover Region C. But what Connolly does is they put out on their website all the different things that they're looking for. And you can see this first example I have is just the pediatric codes exceeding the age parameters that CMS has issued, right? So if I click here, you can see, a breakdown of what this requirement is, and essentially, the description here lays it out pretty nicely. So it's newborn or pediatric CPT codes that are being applied or billed for patients which exceed the age limit. So they basically say that if you're older than 32 days, then you can't be defined as newborn anymore. And back to my slides. Let's see. So this is just a screenshot of what we were just looking at there. And so here's an example of how Connolly may be doing this. I know that I'm pretty sure that they're an IDEA user. I don't know if they use IDEA for this stuff or not, but I can tell you IDEA is a great tool for finding it, so I would assume they probably do use IDEA, and they probably use a function similar to this one. And I'm going to lay out what this one is doing here. But this is just an if statement that's looking into to see if we've got an anomaly for a newborn procedure. So real quick, you can see CPT code 99460. What that CPT code is that's an initial visit of a newborn by the pediatrician. So that's also a once in a lifetime. It's a one-time procedure, and what it does is if your pediatrician comes and they have that visit with you, and they have to have it before the first 32 days. When that happens, this particular CPT code is billed out to an insurance company or to CMS, and they are paid on it. Well, what's happening on the back end is they're checking to see if that patient was indeed a newborn. And they do that by seeing, okay, the date of service, the difference, or the age, like we just did a moment ago, the age between the date of service and the patient's date of birth. And when you check that, if it's greater than 32 days or if it's 33 or more, then we've got an age mismatch. So that's one example. Another example, this one's always a fun one. This is an example where we've got a gender anomaly. So we know more information about the patient since we have all this stuff in our health information system. We know what their gender is, we know what their age is, all this good stuff. So we can also data mine for this scenario where we have accidentally maybe used a CPT code for a hysterectomy on one of our male patients. So that would be a gender mismatch. Obviously, a male cannot have hysterectomy. So these are the types of anomalies that CMS is looking for, or what they've hired these recovery audit contractors to look for. So, as I just showed you, IDEA is a great tool for data mining for this stuff. And the neat thing about it is once we find a good analytic like we have here, we can basically put this into a continuous monitoring application or a script, an IDEA script, to constantly monitor or find these discrepancies or exceptions in real time. So we want to be able to find these things quickly and hopefully before the bill even goes out. So just to give you an idea of some of the things that you can use a tool like IDEA for to help prevent these types of things from occurring is a powerful thing. Okay, so obviously the impact, minimizing future exposure, being able to quantify the existing exposure more accurately, that's also very key. And being able to become more proactive and self-report findings to avoid all the potential interest and penalties and all of that good stuff. So key thing, though, is being able to respond quickly with quality information, obviously. Okay. So now I'm going to get into the payer contract modeling. This is the framework that I've kind of developed. it's a way of looking or using IDEA as a tool to look and see if our payers are paying us or paying us out of contract. And it's not just their payment, it's really an allowable check. We're checking to make sure that the payers calculated the correct allowable, and that's based on the contract, right? So we have a contract with these different payers that lay out exactly how that allowable should be determined, and anytime it's determined some other way or a deviation from the way it should have been or a deviation from our agreement, I want to be able to detect every one of those so I can hopefully get that revenue leakage. Okay, so this is an area to me where there's great problems. Obviously, this is a very complex area whenever we're talking about the reimbursement cycle. And anyway, wherever there's great problems, there's great opportunities. And Yisho Chen, a professor at LSU, told me this, and I really loved it. The Chinese, they use their word for crisis is the same word for danger and opportunity. So I kind of look at that as where there's great opportunity, there's great problems, but also where there's great problems, there's great opportunity. So how do we do this? We do this through our data mining approach, and I'm going to kind of break into what that is. Okay? So before we get into that, I'm going to kind of just talk through data analysis functions, because I'm sure our attendees are at all different levels. So I want to just kind of give you a high level of the different types of functions and things that we're using in this data mining tool to help us determine certain things. So this is an example here of using a join, and this is not a healthcare specific example. This is, you know, it kind of applies to everybody in business. We've got a general ledger and a bank statement, and this is a situation where we're using a join to compare against two disparate systems. So one would be the data from the bank, the other would be the data from our financials or our financial or accounting system, and we want to know anytime those don't line up because we're hoping they do, and they should. So you can see here 2 out of 3 didn't line up. Some of the situations were, you know, miskeys, or some of them, it looks like they were all miskeys on one side or the other. So anyway, this would be an example of comparing and using a join to find where there are situations where it didn't match like it should. Now there's other times when we use a join to find matches between systems that we wouldn't expect to exist, or if they do exist, we surely want to know about them. So an example of that, we have a vendor database, a patient database, an employee database. So all these different places that keep information about our patients. Another one keeps information about our vendors, another keeps information about our employees. Well, a match that we may not want to see pop up is where we have matching contact information, or wherever we have a situation where our employee may also be one of our patients, or one of our patients may also be one of our vendors, or where our employee might be one of our vendors, right? That would be the one, that last one would be one we'd really want to know about. One of our employees is our vendors, because that could be a fictitious vendor they had set up, right? And or falsely billing or making payments to this vendor that are really just going to themselves. So that's an example of when we're looking for, you know, matches that should not exist. Okay, some other data analysis functions. Summarizations, that's going to be a big one. I'll give you an example of that in a moment. Field manipulation, that's what we did a second ago when we added the aging functions. That's adding a field. Pivot tables, we also just did a moment ago. Appends, that would be when we have maybe 12 data sets for each month's activity, and we don't have a data set with all 12. We would append those together just to get a full year. So that's another example. Aging functions, and there's all kind of different functions. Aging are a key one, but two other ones down here we're not going to cover. Duplicate detection and gap analysis. Just real quick, duplicate detection, that would be, you know, maybe finding duplicate claims that we've sent out on accident, or maybe duplicate invoices that we paid on, if we're talking accounts payable. Gap analysis, that would be like, easy example is always an invoice number or a check number, things that should follow a sequence. So whenever we have a gap in those sequences, we want to know about them, because that could be potential invoice that was just it was issued and then deleted or taken out because it was a fictitious invoice, or a situation where we've got a gap where in a check sequence, same type of thing. Those are financial controls, and we want to see if there are any gaps or any duplicates. Okay, so payer contract modeling concept. So really what we're doing here is we're looking for any or identifying any out-of-contract behavior. That's the key thing we're looking for here, and we're looking across 3 disparate systems. So we've got our health information system, where we've got all kind of information related to the patient, the date of service, all of the different procedures that were performed, the diagnoses, etc. Then we have the payer contract, which kind of lays out and stipulates exactly how you are to be reimbursed for certain scenarios, etc. And then we have the payments and disallowances that were actually applied or posted into your system, right? So all of these different things, these are all different pieces, and we want to compare across them to see if everything lines up like it should. So I'm going to give you a quick overview of how my approach with this works using IDEA. So I'm going to give you a little quick overview of how the payer contracts work, and then I'm going to get into some examples and get under the hood of how the IDEA functions work. Because this would be a script, right? This would be an IDEA script that I would create, because you'll see that it's a process to set this thing up. But what I want to do is set this up to where I can always be running it to see anytime I've got new exceptions as new data comes in. With fresh data, I want to be able to rerun it with the fresh data over and over and find the exceptions very quickly, because here's the key thing. With any fraud, waste, abuse, errors, all of these things, the key driver of the financial losses is always time. The duration of time is going to be the biggest contributor to those financial losses, because even if it's a lot in a short amount of time, the chances of that happening again in that short amount of time becoming a long amount of time is very likely, especially if it's benefiting some particular people, right? So what we want to do is be able to find these things very quickly and reduce those financial losses by finding them quickly. So how do these payer contracts work? And I'm probably preaching to the choir here on this. I'm sure you all are very familiar with how they work, but just in case some folks aren't, I want to give a high level. So they're really based on fee schedules. Some of the time, they don't actually give you the fee schedule. You got to go out and create it. I'll show you an example of that. And then there's these contractual provisions, and that last one is really where the health information systems that I've dealt with really miss the mark, because some of them try to do this payer contract modeling within their tool, and when the contractual provisions come into play, that's where you're really going to end up with getting so many false positives without applying these contractual provisions that really the discrepancy report kind of starts to lose its value. So fee schedules. I'm gonna, here's an inpatient fee schedule example. This one's based on a DRG, and you can see there's a DRG code listed there, and some fees or rates associated with it for the different plans. You see a PPO rate, and a POS rate, and I guess they're just PPO and POS here. So that would be the fee schedule. Before any provisions were applied. That would be the fee, and some of the time the contract says it's a percentage of this fee schedule amount as well. So that's just something to look at as well. So they may say 80% of this fee schedule. So instead of it being, this $17,452 for that PPO rate, it would be that times 0.8 to come up with what the expected rate would actually be for you. Then we've got an outpatient example here. You can see we've got a CPT code and an associated rate right there next to it. So here's a scenario where they don't give you the code and the associated rate. They tell you to use the CMS's MSVRG weight table and apply some multiple to it. In this case, it's $5,000. So CMS, they have a MSVRG weight table that you can access and get from in Excel format from cms.gov. And basically how this would work is in this fee schedule that we would create, since this is an example where the fee schedule wasn't already created for us, what we would do is we just take this $5,000 multiple that they gave us, and we'd apply it times the rate for MSDRG 001, which is a heart transplant. This would be what that expected reimbursement would be for that particular procedure. Okay, so let's see. Can I get into here? So this would be essentially the exercise that we would be performing, right? We would go in and we would be creating this table that has all of the different DRGs and CPT codes, the expected reimbursement that we determine. I also put other stuff in there, like if what the calculation method from the contract was, just different things like that that'll help us when we go do research later. So also obviously the carrier and all that good stuff. So what I want to do first, come back to the slides. Okay. All right. So this approach, to combine them all, what we're doing is we're essentially coming up with this rate table that we can then use to join with our new health information data set as we pull it. And the next piece we got to deal with is the contractual provisions. Again, this is where most of the systems kind of miss the mark because there's a lot of things that are going to affect it. We're not necessarily getting that $100,000 for that MSDRG 001 if there's some other procedures group with it, as an example, or maybe if there's or maybe it was during a global period, or it was co-managed. We had multiple doctors in there, or maybe we didn't get it filed on a timely basis, and we missed our timely filing period. So there's all kind of things that can affect it to where if we're just looking at did it match up with the rate without considering all these other elements, we're going to have false positives just out the wazoo. So just an example of how you can use IDEA to figure out these provisions and apply them. Here's an example of that multiple outpatient procedure determination. Now this would be just the formula to determine if we have a situation where we have multiple outpatient procedures in one case or in one setting. So this would be, in other words, the same patient, they came in and they had 6 things done all in the same visit. Well, of those 6 things, were any of them considered an outpatient procedure, and did we have more than one in that particular setting? So so what this formula down here is doing is looking at the procedure code, and it's saying, okay, if it's in this range between CPT code 10000 all the way to 36262, or if it's in this other range of 36420 to 69999, then give me a 1. So what I'm doing, and if it's not, then give me a 0. So what I'm doing is it's flagging each of those line items, saying, okay, we have an outpatient procedure that falls in these ranges, so we have a scenario here. And then when I do a summarization by case, which I'll show you here, so then when I summarize, this would be the data by case. So real quick, we were looking at this data. You'll see, okay, so you'll see this particular patient came in for this case, and there's all of these different procedures, right? So they came in for all these different procedures. Well, that multiple outpatient procedure function or determination function would say, okay, did it fall in a range? If it did, it give it a 1. So then when I summarize it, I can then total what those, if I had a 1 next to this one, a 1 next to this one, and a 1 next to this one, I know I have 3. But when I do my sum by case, I would have a 3 here. So you can see I didn't have any on these cases. In this case, I had 2. So I'm going to click here and show you that I indeed had 2. So these will be the 2 records. I'm sorry. Okay, so these would be the 2 records, and I can see that both of them did indeed fall in that particular range. And that was a Blue Cross one, so that was a little different. So anyway, what that enables you to do is then know what that determination was. So then you can use another function to say, okay, well, if that determination is greater than 1, in other words, meaning 2 or more, then we know that we have a multiple outpatient procedures in one setting, so we need to apply what the contract said as far as the provision applies. right. So what files and data are needed? So obviously we just talked through this exercise of creating this fee schedule. So we'd obviously need that and have it all in one table at least for the process I've laid out here would be important. And then being able to data mine the health information, getting that health information system data as well. So that can be exported out of your system, or maybe it's an ODBC connection to your system. But I can tell you with IDEA, it's important, or with anytime you're doing any data mining, I always like to keep an arm's length from the production data. So I don't want to have any potential of harming that data. I want to keep it protected. So I would rather get get a copy or an extraction of that data and drop maybe into a shared folder or some place to where this script can go grab the new fresh data each time and run it and see, okay, what our new exceptions are. So again, real quick on the join. So what we do is, so we get these two data sets and we do a join. And so the primary database would be that hospital data that we exported from our health information system. And that secondary data set would be the combined fee schedule. And what we would do is just do a join on the carrier. Maybe it's a carrier ID. And then the code would be the CPT code. Sorry, the CPT code. So, or DRG code. So then it's important to understand in this whole build-up method that I just kind of went through very quickly to understand that reimbursement is based on the entire case. So in other words, the contract's going to lay out what it should be at the procedure level, and it also lays out how that rolls into the case level, which reimbursement is ultimately determined on. So what we do is we first lay everything out at that transaction level, then we summarize it to get it to that case level, and then we can determine exactly what the differences are between expected rate and the expected rate and then what they actually paid us. So an example here, you can see this is what that would be. So you can see here's what the charge was, here's what was paid, the expected amount was this. The difference between what was expected and paid is right here. So you can see again here, we had this is what was paid, this is what was expected. At the end of the day, this was actually what was expected, and this is a scenario where they didn't pay us $350. All right. Okay, I've kind of already covered this here. So here's some other things of applying business rules. This is also going to be a key thing. So a lot of cases, like we may use one field that has a whole lot of good information in it. So here's an example where the doctor number, the first two digits of it represented the location. So some of the time, we use a doctor number that we may have set up when we had an older antiquated system that maybe didn't enable us to track other things, so we used another process to track those things, right? And then we've kind of held on to that process. Well, in those kind of scenarios, we can use IDEA to determine what those things are, give us a field that tells us what the location was, like in this example. So what this thing's doing is just going through and saying, okay, if the first two digits of the doctor number 11 or some of these others, then we know that it's a Hammond Clinic claim or Baton Rouge facility claim, that kind of thing. So another example under the hood, applying business rules. Also we have, a lot of times we got dirty data. So being able to cleanse or normalize that data to where, when we do that summarization or when we do that pivot table and we're looking at our payer mix, we don't have 20 different Blue Crosses down there. In this example, this is using the actual names. Some of the time, it's easier just to use their little insurance ID codes in the system, but you can go either route. Another example here of applying additional business rules, this would be cleansing data in preparation of a join. So, a lot of times all these different contracts are changing, so we may have a field that determines, okay, which contract does it fall under. So, if the data surface falls in a given range, we know which contract it falls under. And as far as what the script looks like when you're in the driver's seat, it's set up either as simple as where there's some interaction where it's like basically the script's all there. All you do is you click run, and then it's going to say, okay, select your sample clinical data, or it's going to say select your clinical data. And then what you do is you go browse like you would an attachment to find that file, and then you would select OK, and then it's going to ask you, hey, go find this sample expected reimbursement data now. And what you do is the same thing, browse for it and find it. And then it's going to spit out the results like we looked at an idea a moment ago, and it's going to go ahead and perform all those things, and you'll be able to have your exceptions ready to go. Now that's all kind of under the hood. There's also additional things that you can implement over these things to really make it slick, to where the whole workflow and everything else is all managed in one place in a very very quality continuous monitoring software that Automation Services puts out. It's called Caseware Monitor, and it uses all different kinds of engines, ACL, but the key one it uses is IDEA for me. And when I use all these things or build these IDEA scripts, we can then roll these into this monitoring framework, and it'll route the exceptions to the appropriate people based on how we specify all of that. And it can also monitor how quickly the appropriate people are working those exceptions. So all of that different stuff's tracked to where not only do we know when an exception happens in that it went out to the appropriate person, but that person actually did something and looked into why and fixed the issue. So this would be an example of the email notification that Monitor would send out. It'd send out saying, hey, you could send it out to the manager, but also to the person that's working the discrepancy, saying, hey, this is the risk level, this is how many, and then you would log into the web page by clicking the link, and then you would have all that stuff in that cloud-based system, and you can work your exceptions that way. So just real quick to wrap it up, the kind of that process or framework for the payer contract modeling, essentially, kind of lays out like this here in this example. The first thing you got to do is obviously go through the assessment process, and what I like to do is go through the detection process as an ad hoc basis, and when I'm doing that, I determine, okay, which ones would be good for analytics to run all the time or run continuously. And that's really based on after detecting, doing this thorough analysis and looking for the root causes, etc. Once that's determined, we figure out, okay, some of these are really good. We want to know every time this scenario happens. We would then turn that into a monitoring control using either a continuous monitoring tool like IDEA, or an even superior one to that, like a Caseware Monitor that does even more of the automates even more of the processes and steps there. And with that, that really concludes this webinar. So I wanted to open it up to questions and everything else.
Thank you, Chris, for sharing all this great information with us. We do have a few questions. The first question is about IDEA scripting, namely how powerful is IDEA scripting? The person who asked the question uses another data analytics tool. How powerful is IDEA scripting, and how easy is it to use?
That's a great question. And I think that'll get me to jump back into IDEA just to show you how easy. Okay, so with IDEA script, you can perform a number of analytics and do a number of steps in IDEA. And when you do those, it keeps track of everything you're doing. So it keeps track of multiple places too. So you can come in here and look at the history and see what all we did. So we started with an import from Excel as an example. Well, you see that all of the scripts related to this is all right here. And you can simply copy the scripts for those tasks just by right-clicking, and without writing any Visual Basic code, you can see here, this is all of the things that I would need to do to rerun this script, to rerun those steps without having to actually go here in the user interface and click, the import button as an example. So, hold on, let's look at I got okay. So you can see here, that's how easy it is. And there's even an easier way than that, because you can visualize it by looking over here in the project overview. Hold on one second. So you can see here in the project overview, these are all the different steps that we did. And a lot of times this is really critical, because the first time we do it, we're going to do it ad hoc, and we're going to have situations like you see here where these we didn't end up using. So just to show you how easy this is, you can create a macro just by selecting the ones that you want. I'm going to show you how to do that real quick. So I've selected all these, and I can say create an idea script, click finish, and it tells me it's ready when I close this out. So then when I close it, here's all the steps. This is all the different Excel imports, so importing all that different information. You can see these are the joins that were performed, all of the appended fields that were performed, and again, all of that code is all stored right in the system without me writing any of it. It's all already in there. So when I'm just performing and clicking in the tool, it's keeping track of every click and everything I've done, so that way it's already there ready to go when I want to reperform it.
Thank you. Our next question is, would you audit using payer contract modeling only one contract at a time with IDEA?
That's another great question. I actually I do not. I apply. I'll monitor multiple contracts at one time. Now typically what it will do, that brings up a great point as well I didn't mention. What I will do is I'll pick the top payers. A lot of times we'll look and see at that payer mix, you'll find that the majority of your claims or your payer mix is made up of just a few payers. So and usually in that short list is going to be Blue Cross Blue Shield, Medicare and Medicaid, and usually a Humana or a Cigna or one of those. So it's usually about 5 or 6, sometimes as few as 3, that really make up 90% of the claims or of the dollars. So what I do is I usually focus in on those first, and if we start maybe noticing some issues with some of the other payers, that or maybe there's a certain ones that don't maybe fall in that 90% or that top 5, those can be added. But I always start with the big ones first, because again, we're looking for a needle in a haystack with these things. You're looking for about maybe 5 to 10% errors. So when you're looking at a huge population of data, finding that little small percentage is tough. And really, if you're going to take this approach and apply all of these contracts at once, then it's going to be really tough. So you want to pick just the top ones first and kind of work your way from there.
Right. What is your experience in data extraction from Epic? Do you use Clarity, Epic reporting, Crystal reporting, or do you just stick with IDEA?
Again, I mainly use IDEA for everything. I do use Crystal reports, and as far as specific to Epic, really as far as getting the data, extracting the data out, with the experience I've had with that, I've always leaned on the hospital to provide that information. So they're extracting it out. I know that in some cases they're using Crystal report, but a lot of times what I'm getting is raw data from the actual tables. That's what I prefer, because a lot of times when like in that example I showed earlier, if you're just running it on a certain data service range or something like that, like if we have a data entry error and they key in like they did 2010 as 2001, well, that claim may fall out of my population, and I would want that in there.
Okay, and this is kind of a follow-up to the previous question. do you set up one IDEA project for each payer, or does IDEA allow you to design tests for multiple payers all in one project?
You can have multiple payers on one project, which is the way I like to approach it, because I don't want to have to go into a different file for each payer. I'd rather look at all of the exceptions for all the payers I'm monitoring. So, but you could do it either way. But I typically take the approach of having it all in one project.
And can you please provide the website information for the CMS payment review metrics, such as those for age-limited services or services that should only happen once in a lifetime?
Oh yeah, sure. That was the different recovery audit contractors' websites. This one that I went to is Connolly Consulting, which again was for Region C. And let me give you this address here. It's just www.connolly.com. And when you come into Connolly's website, they have the CMS RAC program. You can you click here, and let me just show you how exactly I got there. You see this important links. It has approved issues right there. If you click the approved issues, you can see the list of all of them right here, and they've got multiple pages of them, and you can sort by the different types. So the ones that I was looking at and talking to today, the issue types were automated. So these are ones that they're doing just straight data mining. They're not going to call and ask you for your data. They're not going to call and ask you for your charts. None of that. They already have all that because you're submitting it to CMS. So they're getting that data from CMS, and they're running it through to see are there any of these exceptions exist. So the ones that I was talking to today were the automated ones that they're using pure data mining on. They have some that are semi-automated, and they also have some that are complex, which require the chart itself.
Thank you. I haven't received any more questions. Thank you very much for all your very helpful information. Chris is an excellent resource for solving even the most complex business challenges, and he works with clients in many other industries, including construction, oil and gas, government agencies, and small businesses. In fact, Automation Services admired his work so much that a couple of years ago we asked him to join our Integration Partner Program to provide our clients with idea script development, automation, and data analysis consulting services, and much, much more. On your screen, you should see Chris's contact information, so if you have any additional questions, you can get in contact with him directly. We will be sending out the slides as well as a recording. We'll also make available a recording of this webcast if you would like to watch it again. And we should send that in the next week or so. Thank you, Chris, and thank you, everyone, for joining us today. Have a great day.